Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters. Tonight in studio we have a special guest, a very esteemed colleague of mine, Dr. Ifrat Barnes, who is actually the medical director of the Child Abuse Clinic at Charlotte Makeke. We will speak more to that in a short while, but as is customary, we will begin with the tarbiyah. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. The words of the Quran and the authentic traditions of Prophet Muhammad, peace be upon him, contain the mercy and blessings of God be upon him, contain the rights and responsibilities granted by God to humankind. They are not subject to the whims and desires of men or women. Therefore, they do not change. These unique rights mentioned in Islam also include the rights of children. Children's rights are not guaranteed by the actions of their parents, their communities, or even their governments. God Himself guarantees children's rights. Islam establishes a legal framework and embodies a code of ethics designed to protect the rights of an individual, including his or her right to live in a secure society. For children, security is of the utmost importance. The rights of a child begin even before birth. In fact, they begin before conception. The Quran and the authentic traditions of Prophet Muhammad, peace be upon him, make it clear that two people should not enter into a marriage carelessly. A great deal of thought and preparation is necessary before man and woman commit to each other and to the family that may result from their union. Prophet Muhammad, peace be upon him, was heard to say, "A woman may be married for 4 reasons: her wealth, her image, her beauty, her lineage, and most important of all, her religious commitment." Marry the one who is religiously committed. If a man and a woman have both dedicated their lives to worshipping and pleasing their Creator, then the rights of any children they may have are automatically guaranteed. Worshipping God means obeying His commandments, and His commandments include securing the rights of the child. By marrying rather than having an illicit relationship, the couple has already begun to secure the rights of their future children. A child has the right to know and understand his or her lineage. Once a child is conceived, it has the right to life. The Quran makes it very clear that all life is sacred. It is never permissible to terminate a pregnancy because one fears being unable to financially support a child or another child. It is God who is the provider and sustainer of all life. When making a decision to terminate a pregnancy, it is important to remember that having a child is a blessing from God, and all such blessings should be accepted with joy and gratitude. And children are not toys or possessions. With them comes great responsibility. وآخر دعوانا الحمد لله رب العالمين. As I have mentioned, that our esteemed guest tonight is Dr. Ifrat Barnes, who has been in the field for more than 20 years. She has, however, been in the field of child abuse for the past 10 years. She has presented at many national and international conferences on child abuse and is considered a leading expert in the country. Dr. Barnes's focus on the topic tonight is on child abuse and its impact and effects on child development. She also has a lot of experience in neurodevelopmental pediatrics, where she is working in at Charlotte Makeke in the neurodevelopmental clinic as well. Assalamu alaikum. Welcome, Dr. Barnes. And I think we can begin because your focus is on child development, but I think you would like to focus on child abuse, the cases that you see daily, and perhaps to bring the viewers into perspective around the kind of work you do and what you come into contact on a daily basis with.
Thank you so much for having me. I think it's important when we speak about child abuse and neurodevelopment, those seem to be two very separate subjects, and yet there's quite a bit of overlap between the two of them. The reason for that is because children who are neurodevelopmentally delayed, intellectually disabled, are the ones that are most vulnerable and are often the ones that are abused. We also found that children that have been abused will present with some sort of neurodevelopmental delay. And because I spend time with both those types of patients, I think it's important for me to relay this information onto your viewers, because I want them to realize how susceptible these children are. If we look at autism, for example, it's a very common disease, unfortunately. The statistics are 1 in 68 children. So that's extremely relevant to today's day and age, considering how many children are born every day. And what we need to realize is that those children with autism, they do, of course, fall on a spectrum, but those children are exceptionally vulnerable to abuse. And as long as we can empower those people that are looking after them, we can prevent any further abuse from happening.
Now, Dr. Barnes, you speak about children. What ages are we actually looking at when you mention children, the terms of reference that we're looking at? What age groups are we looking at?
I think that when we talk about disabled children, we need to remember that their mental age does not necessarily correspond to their actual age, and that's where they are at a much greater risk. So, for example, we can see a child of 18 who's severely autistic and is in fact functioning like a 2-year-old. We had a case at the hospital that we saw of a child who was being groomed, and unfortunately everyone saw it as being something that was very innocent. Because he was such a grown man and had already developed secondary characteristics of adulthood, no one saw him as being such an easy target. So abuse will occur at any age, but obviously children under the age of 18 are most vulnerable, and then children who are intellectually disabled remain vulnerable for life.
And it's quite evident that young children don't always have the capacity to explain or make that coherent disclosure, and children with disabilities are, of course, at a greater disadvantage and are therefore a bigger target or are easier prey to be violated. Now, you mentioned child abuse. Perhaps that may sound like something very broad. Can we sort of be more specific to what you mean by child abuse?
So I think child abuse is the maltreatment of children that would obviously include physical abuse. We do, unfortunately, see sexual abuse. We see neglect, which I see as being the silent killer, because neglect happens so often and people overlook it. So, for example, neglect of a child who's been ill and the parents don't seek medical help. The other thing which I wanted to mention as well, when you discussed termination of pregnancy, a lot of late abortions take place in our country, and instead of it being a successful abortion, conception, the child is delivered and is often left with severe intellectual disabilities and is often born very premature. And prematurity obviously leads to a lot of neurological complications that involve the brain and the rest of the body. So abuse carries a massive weight simply because it can affect so many children. And as you mentioned earlier, children that are non-verbal or pre-verbal are the ones that are the easiest target because they're not going to be able to identify that perpetrator or to verbalize that they are at risk.
So if I'm understanding you correctly, you're speaking about different forms of abuse. I'm getting the understanding that you're making reference to physical abuse and sexual abuse, but of course, underlying that, it's inevitable there's emotional abuse and often neglect as well.
Absolutely. And what we know is if we look at graphs that look at the statistics of the different types of abuse, we know that they often overlap. So, for example, a child who is sexually abused is a lot of the time physically abused or emotionally abused as well. So it's important for parents to identify these things and also to look for all the telltale signs that are associated with them.
Now, I've also heard you mention before about the importance of the first 1,000 days, and perhaps you can share that with the viewers around the significance of those first 1,000 days in a child's life.
I'm so glad you mentioned that again, because with reference to what you said earlier about termination of pregnancies. So the first 1,000 days in a child's life actually start from the moment of conception. The brain starts to form on day 18 of the fertilized egg's life. So that's really early, and any types of medication, even stress that is experienced by the mother is going to be somehow felt, and the fetus is going to be exposed to. And that's why we feel that development is so important, and we need to put so much emphasis on development and primarily on the mother and child bonding, because impaired bonding, when the mother is not able to bond with her child, we know has detrimental effects that are lifelong.
So what you're saying is actually not only is it interesting, it's fascinating, but looking at the trajectory of the child. So if we're looking at that pathway, what are some of the things that you could predict in terms of the impact or the imprint it leaves, earlier childhood experiences having an impact on later life?
So we've recently had a presentation at an international congress by a team of neurobiologists from Harvard, where they looked at negative childhood experiences and their effects later on in life. And we're talking about trauma, so we're talking about abuse, all the types of abuse that we've mentioned, but we've even talked about children that are witnessing things like family violence and the detrimental effects, and the increase in the number of mental illness is explosive. And so what we need to remember is that as that brain is developing all the way from the time of conception right through to childhood, it is such a vulnerable time where those neurons in the brain are learning, adjusting, forming new pathways. And unfortunately, any type of trauma can later on cause repercussions.
So you're talking about the nerve fibers, the nerve fiber endings, and the synaptic nerves, of course, adjusting, because it certainly leaves this imprint, this negative experience leaves an imprint And of course, it would affect the behavior of the child. But we'll continue with that because I think it's something that one needs to look at because of the compelling body of evidence that is being presented by scientists out there. On that note, we'll take an ad break and continue with the child abuse and its effect on children's development. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. For the viewers that have just tuned in, we have our guest in studio today is Dr. Ifrat Barnes, who is an expert on child development and its effects, any neurodevelopmental changes on the brain as a result of child abuse. Now, Ifrat, we were talking about, you mentioned something about children witnessing family violence, domestic violence, and its impact on the changes in the brain. Now, I would identify that as one of the risk factors, and I'm sure there are other risk factors that would also contribute to changes, neurodevelopmental changes on the brain.
So I think that it's important to bring up family violence. I think that living in a violent society as we do, children do witness all sorts of violence, rape, sexual abuse, any type of abuse, as we mentioned earlier, and any trauma that would occur in a child's life will have an impact on the brain structure itself. They've actually been able to image the brains and actually show that the trauma causes a change in the structure between the two sides of the brain. The two hemispheres of the brain, the right and the left hemispheres, are connected by what is known as the corpus callosum. And what they found in cases of chronic trauma is thinning of this corpus callosum. This corpus callosum is what links, it's a highway that links the two sides of the brain, and suddenly you've got a brain that's just working almost with hemi-neglect of the one side. So the other thing that we need to remember as well is the effects of trauma on structures of the brain, like the amygdala. The amygdala is an area in the brain that's shaped like an almond. It's where all our source of fear and anger is stored. And when that grows and that is not inhibited, your prefrontal cortex is not able to function. Your prefrontal cortex lies in the frontal area of your brain, and that's where your executive functioning comes from. That's where your decision making comes from, your impulse control comes from, choosing between right and wrong. So the long-term implications are obviously not just translated into childhood, but into adulthood. So if we have healthy children, that will translate to a healthy adult population as well.
So your risk factors, are there other risk factors? I mean, what about head injuries?
So head injuries are obviously very important, and it's something that I'm particularly passionate about. It was previously known as the shaken baby syndrome. Abuse of head injuries, which are caused by rotational forces to a child's head. A child's head, in comparison to the rest of its body, is relatively big, and children are known, especially babies, are known to have very poor head control. And when children are abused and shaken, those transitional forces, which are rotational forces, cause tearing of the neurons of the brain. This often leads to blindness, deafness or hearing difficulties, you can get catastrophic bleeds, which can lead to death, and you can also present with long-term complications such as epilepsy. We must also remember that every time a child has an epileptic attack, certain brain structures are being destroyed, and that's why
cells are dying.
Cells are dying, and that's why we pay so much emphasis on trying to keep a child fit-free and seizure-free, because we want to try and save as many neurons as possible. We know that the brain does not heal itself. In recent years, we know that there is some brain plasticity where the brain can regenerate to a certain extent, but massive bleeds and massive trauma we can't obviously repair.
And this could result in brain damage.
Severe brain damage. So most of the children with abusive head injuries, often a third of them will actually die due to the injuries they've sustained and due to massive bleeding into the brain. The massive bleeding in the brain causes a very high pressure to form in the brain, and that very high pressure compresses regions of the brain that we need for your heart to keep pumping, for you to keep breathing. And once that area is compromised, the patient dies.
So I want to ask you a question. I think this will be of interest to the viewers. So who's instrumental or responsible for this acute head injury? I mean, if we just look at the statistics of the pattern of referrals that you receive, who's responsible for that?
I think that the majority of the time it's the parents. We do see a very high incidence amongst male fathers. We know that the male population is often more responsible for these cases, just purely seen in studies. We know that certain things like use of drugs or even anabolic steroids, people using testosterone to try and become well-defined at the gym, that is often associated with an increase in aggression and that inability, again, for your prefrontal cortex to function and for you to control those impulses. So those are the children that are definitely at risk. But studies do show that mothers can be responsible and caregivers as well.
But again, from your case studies at the hospital, what is it that you're seeing? And I think we also need to understand what do they actually do to these children to inflict that level of injury to result in brain damage or trauma to the brain?
So, first of all, there are definite risk factors. I've mentioned the male gender being a risk factor for abusing their child. Young parents, young mothers, the lack of support, people who have very sick children, children who are colicky. We know that certain babies who are born premature or who are born ill are more likely to cry. And they've actually got an association between the amount of crying and the likelihood of their child being abused.
So what is it that the mother would do or the father would do to their child that's crying to result in this kind of damage?
So I think it's that sheer frustration that individual feels, and it's associated with a shaking of the child. Okay, so perhaps,
if you can explain that shaking, because I don't think people can understand how, the level of force that is exerted on that little child.
So I think what we have to remember is that the younger the child, the less force one would need, but at the same time, it is a rotational force. So I'm not talking about a child who's being held up and slips in a car seat, for example. I'm talking about a child that's been rocked backwards and forwards, where there is such shearing forces between the neurons that it actually tears the parenchyma of the brain, which is what the brain is made up of. and it's rotational forces as well. So when we get told that a child, for example, has got a bleed in the brain because they have fallen off a couch, that's virtually impossible. There are a lot of people watching tonight who have children, and a lot of them have got children who have fallen, and none of them have had these massive bleeds in the brain. And the reason for that is unless you have some sort of a medical condition that predisposes you to bleed, you would need these transitional forces, which are rotational forces in nature, causing the shearing injuries. So there's a massive amount of impact and non-impact caused during this time. And the other thing as well is we often find that these kids present with other injuries, such as fractures to the ribs because of the way that the child is held and the squeezing onto the very soft bones in a young child.
So it's actually using brute force on a very fragile, tender child who cannot do anything about the situation.
Exactly.
On that note, we'll take an ad break and continue with the discussion. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. Our guest in studio tonight is Dr. Ifrat Barnes, who is talking about the impact of child abuse on the brain. Dr. Barnes, before the ad break, we were speaking about abusive head injuries and the outcomes. You did speak a little to the outcomes, perhaps if you could continue that discussion.
So we mentioned that a third of these children die because of these catastrophic bleeds. Another third will be severely disabled even at the time of presentation. They will survive that bleed and then be discharged with severe disability. We've spoken about epilepsy and other intellectual disabilities. The last third are the types that are discharged where we think that everything is fine, but if we follow them up in the long term, we actually find that they present with some sort of learning disorder or other intellectual disabilities later on in life. So again, this is emotional trauma plus the physical trauma that the child is actually exposed to, all condensed into one, resulting in lifelong suffering for this innocent child.
Now, I know you've looked at longitudinal studies and the implications of early childhood trauma and the long-term effects of that earlier experiences or the earlier negative experiences. Could you perhaps speak to that?
So we've been studying this for a while. It's been studied since the 60s, where people have looked at adverse childhood events and the long-term effects of it, where these people are more likely to abuse drugs, to develop delinquent behavior, to drop out of school, to be exposed and be involved in illicit relationships. So the risk-taking behavior is definitely increased, and again that is linked to that trauma and the growth of that small part of the brain that I spoke about, the amygdala, where it's inhibiting your prefrontal cortex, where your intellectual higher level of functioning is telling you no, that's not a safe option to try. So these children with adverse childhood events present with a higher incidence of smoking, a higher incidence of drinking, more likely to be involved in delinquent behavior, stealing, theft, etc. And recently, as recent as June this year, a group of neurobiologists have actually released some information about the adverse childhood events, and they've looked at the presentation, comparing boys and girls, and also pinpointed certain times in children's lives where they are more vulnerable. So, for example, boys are more vulnerable at the age of 6 to emotional abuse. And girls at the age of 14 are more vulnerable to being abused and trauma due to peer pressure. So the long-term effects are so detrimental that we really need to put a lot of emphasis to our to creating mentally healthy children. The other thing that we know is the massive increase in psychiatric conditions and specifically in depression associated with adverse childhood events.
So what advice would you give to viewers out there? Because I know you have mentioned in the past about a 3-month-old baby, being given an explanation that the baby rolled off the bed and therefore experienced this level of trauma.
I think that first of all, parents need to be aware, and if something doesn't make sense, you should definitely seek the correct assistance and the correct advice. The other thing that parents need to be aware of, and I mentioned this right at the start of our interview, is the fact that neurodevelopment and abuse overlap, because often a child who's developing normally at school and doing absolutely normally at school is suddenly failing at school, and that developmental delay, that regression, is often a red light that should be going off and flashing and alerting the parents and the caregivers that something is going on in this child's life. So going back to that baby, the 3-month-old baby, if a mother, for example, leaves her 3-month-old baby with someone who's looking after the child, and the child suddenly presents with a fall, and the explanation is that the child has rolled off the bed, we've got to look at, is it possible for a child of 3 months that can't even sit yet to actually roll off a compactum or off a chair? So things need to add up for us to be able to say, okay, this is possible or not. But the other thing that you did highlight earlier is the fact that abusive head injury is caused by a massive amount of trauma and a large amount of force
that is exerted
onto that developing brain.
So to first-time parents, what would you say to them? What do they need to look out for? Because I think in the real world, a lot of the parents are employed and leaving their children in the care of other caregivers, significant others, but it's alternate care that they have to seek out.
I think there's no easy answer to that. I think the reality is that most people need to work, and they do have to leave their children in the care of somebody else. If it is possible to leave it in the care of somebody that you know and trust, a family member, that's always ideal. We also spoke about bonding earlier, and we know that for a child to form a healthy bonding relationship, they talk about the mummy, the nanny, or the granny. As long as the child bonds with someone, the child will form a secure relationship, and so that is important.
So a secure attachment, it's a positive bonding that the child experiences with a significant other.
Exactly. They actually they talk about a dance that occurs between the caregiver and the mother, and that's why we often see children that have been institutionalized and neglected presenting with such severe brain changes due to neglect. In fact, a study that was conducted by very well-known Professor Berry looks at neglect and looks at a CT scan of a child who's had extreme neglect, where this child was not even handled and not even picked up. So this is a child who's been institutionalized versus a child who's had normal bonding with the mother, where there has been that give and take between the mother and the child, and there's normal brain development, whereas the child that has been neglected has these massive ventricles in the brain, far less brain tissue, and far less brain tissue translates to lower brain functioning as well.
So it's also the atrophy that you spoke to earlier on about the corpus callosum.
The other important thing about that bonding to the mother as well is if we look at kangaroo care, for example, in premature kids, and there's been a lot of evidence and a lot of studies that have shown the importance of just hearing that mother's voice and that skin-to-skin contact,
body contact, yes,
between the premature baby and the mother, and the ability for that kangaroo care to improve weight gain in the premature child, and improve their survival rates.
But also to catch up with the milestones because of that facial contact, eye contact, and the skin contact.
And I think
all the sensory stimulation.
And once the mother is in tune to what the child needs, the mother knows when something is wrong with her child. So going back to what you asked about parents, I think that finding out exactly who you're leaving your child with is very, very important. Yes. In fact, we recently had a meeting with a family where a child was left with somebody who was known to them, but they never researched, they never looked at any references, they never knew whether this person had looked after anyone before or not. So we cannot put enough emphasis on this. You are giving these people your most precious possession, your child.
Priceless,
absolutely priceless. And you need to make sure that that child is safe. In fact, just today I saw a headline where a woman was convicted, a carer was convicted because of hidden cameras that were set up in the house, and she was found to be throwing a toddler around.
I know. I mean, we've had at the clinic where toddlers have been prescribed medication without the knowledge of parents, you know.
And it can be completely deadly. In fact, there was a case recently where a child was given medication and that child ended up in ICU. So you can't be careful enough.
I just want to pick up on what you said earlier about knowing who your child is with. I think it's so important these days because of the child protection register which is in existence, that you, if it's an alternate care, to find out if that person is found to be unsuitable to work with children. So besides the police clearance that one needs to actually get from the person you're employing to take care of your child, one needs to also look at the child protection register to ensure that that person has not been found in violation of working, of harming children.
And obviously affecting children's rights. And I think the other thing as well that we come across often is people using a creche or a care facility that is not registered. And those can be catastrophic because often you find that the ratio of teacher to child is huge. So you can have one teacher looking after 5 kids, which is completely impossible to look after 5 3-month-old babies. So it is important to do your homework before you go back to work. Do the research, find out, is this place registered? Can you speak to any parents that have had their kids there, and make sure that this is a safe environment for them.
And I think what you're saying is it's better to err on the side of caution, to be rather neurotic than to be complacent or nonchalant and blasé about it, because it's your most priceless possession. You're talking about your child's life and your child's future.
I think that's very relevant, and I think that's why, if you look at the Children's Act, doctors are told that even if you suspect abuse, and it's not just doctors, it's anyone, it's an imam, it's anyone who is in a position whether it's a teacher, if you suspect abuse, it is imperative that it's reported and it's not overlooked.
Indeed. We'll continue with the discussion. We're going onto an ad break, and then we'll finish off with the last segment thereafter. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to the last segment of Health Matters. Just a reminder, we've got Dr. Ifrat Barnes who's speaking about the effects of child abuse and on the actual development of the brain and how it affects the brain. Dr. Barnes, you wanted to speak about the developmental delays and what people should look out for and what steps they need to take when they realize something is not right with their child.
So I think that, first of all, one of the best things to do is to make sure that you take your child to the Well Baby Clinic for your baby to be weighed, make sure your baby's growing. The other thing that is important is if you look at our Road to Health chart, which is our clinic card, a lot of emphasis is put onto the child's weight, but very little emphasis is actually put onto the child's head circumference.
Okay.
And perhaps every time you do go for the visit, make sure that they check the child's head circumference, make sure that that child's head is growing. Now, obviously, doctors and pediatricians have become specialists in this, so we don't expect parents to be able to know the exact development. But if you feel that your child is not doing what you think they should be doing, discuss it with the nurse. And then if you are more concerned and you find that the nurse is not able to assist you, I would speak to your GP and then a doctor. The way we approach neurodevelopmental progress at the hospital is we look at the child's abilities at the time that we assess them, and then we give it a functional age and depending on what the child is presenting with. So, for example, a child who's not speaking could have a language or speech delay, and in those cases we would recommend a hearing test, or for example a child who seems to be struggling when they're walking or running may have a visual delay. Premature children often develop injuries to the brain that affects vision in the lower half of their visual field, and often those types of children will walk along but stumble when it comes to steps. So things like that are very important, and again, have it assessed effectively. The other relevance is that if a child is found to have a global developmental delay, where more than 2 areas in this child's development are behind schedule, then in those cases we mark those children as being high risk. We recommend the necessary therapies, but we will also look at special schools for the child just to assist that child. And if we look at government institutions, for example, we do have a large variety of special needs school, but you do need to get those applications in early. And the same is true for private schools. We do have a lot of remedial schools that are available, but space is limited.
I know that is a huge challenge. You also mentioned in the first segment, you spoke to the spectrum of autism, and sending children to those special schools is also quite limiting, again, access to those kind of facilities.
So the government, thankfully, has embarked on an inclusion program where they're now looking at having classes for autistic kids in some of these schools, and this is a way of obviously relieving the pressure on this bottleneck that we have, simply because we've got such a high incidence of autism, 1 in 68 children. And the other thing I must emphasize as well is that we don't actually have an exact cause. We still do not know what causes autism. There are definite associations, but we don't know. And typically with autism, this is the child that is non-verbal. So this is the child that is not able to speak, that is not able to tell you that somebody is hurting them. And again, with abuse, that's where you need to be aware, and you need to have that sixth sense as a parent to know that something is wrong with your child and seek the necessary help.
Okay, we are coming to the end of the session and in this interview. I would like to just allow you a few moments to speak to take-home messages to the viewers out there or to young parents out there?
I think some of the messages that I would like to send out is that have support, have a good support structure. You spoke about a couple before choosing to have children, making sure that they are compatible. I think that making sure that you are ready and you are mature enough to bring a child into this life. It's important for the person carrying the child, for the mother, to remember that the first 1,000 days of life start from the time of conception, and whatever she's exposed to, her fetus is exposed to as well, and obviously has lifelong effects. And then remembering as well that when the child is born, that there is the correct support structure for the family and for the mother as well. Postnatal depression is very common and on the rise, and we know that children who are looked after by severely depressed mothers present in the same way that a very neglected child is, and a child that's been institutionalized. So it is important that the mother as well, that the family unit as well, and that we do try and limit trauma in the child's life. The other thing to remember is that we spoke about finding the correct schools for your child, making sure that they are registered, or doing background checks on care.
Doing your homework thoroughly before leaving the child in the care of any individual out there. We have come to the end of the program, and I am certain that the viewers thoroughly appreciated your inputs and found it very stimulating and enlightening. And on that note, I would like to really express our deep gratitude on behalf of ITV and Health Matters. And we will end with a verse from the Holy Quran. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والأسر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. صدق الله العظيم. Assalamu alaikum wa rahmatullahi wa barakatuh. Until Health Matters next time.